What are you really looking forward to about Midwinter?
So we're going to have neuro-oncology track in the afternoon of the first day. Then we're going to go more in the second day into the dementia space, kicking off with, of course, Alzheimer's disease in the morning of the second day. Not only what we do diagnostically, but making sure that we understand the context, especially with these new amyloid targeted therapies of what we do, including having guest speakers who would talk to us about what we see with ARIA and as well as what we need to do qualitatively and quantitatively to assess patients for selection and response. And just the practical discussions all day and into day three. Day three is more like, ending with a patient care pathway. We're really on the precipice of, neuro-oncology with imaging and targeting of amyloid as the target for neurotheranostics on the dementia side, but on the precipice also for oncology and a variety of targets. And we have a FDA approved tau PET agent. Let's not forget about the neurologists are marching forward, with the importance of tau, not only with the fluid biomarkers, but also with improved imaging agents. And they recognize the importance of that in their new staging system. And, I think that will be a very promising frontier that I think folks would like to hear about and will hear about at this meeting.
I think for us, it's like what I think is really compelling is what type of physician might be or what type of person might be involved, be want to participate. Do you have any thoughts on who this might really be applicable for?
Jake, you said something really crucial in the beginning. This is a very rare opportunity to have in one place at one time all these experts, right, come together to give a very comprehensive, in-depth, both present and near future view of what we're doing with nuclear medicine and molecular imaging of the brain across the spectrum. So it I think would really appeal to everyone interested in brain imaging. So neurologists, neuroradiologists, and of course, nuclear medicine physicians who may not actually do a lot of brain imaging now, but want to find out more because they know it will be only increasing. Really, it's theory to practice across the spectrum of neuro disease, as we know, which is such a diverse set of diseases. And to have the opportunity to have it all dedicated in one meeting doesn't come often. Very excited for it. Bringing together experts for you to interact with, and it's a smaller meeting, so you can after the speaker's done, you can walk up to them after the podium and ask them, like you said, specific questions.
So if you're a nuclear medicine, you should come to Midwinter, definitely heading up for the neurology track, and you should invite your neurology colleagues. If you're in neurology and you really want to expand your knowledge and feel and implement it in your practice in the best possible way for your patients, you should definitely consider going to Midwinter. Such a great lineup of great speakers who really know their stuff and are using this technology. I think it's going to be an awesome meeting. So thanks so much, Phil, and I'm looking
Thank you,
forward to
Jake.
seeing you there.
Yeah, look forward to seeing you there.